Why are African Americans more prone to obesity, heart disease, diabetes than Caucasians, than the Chinese? Why?
It's the diet. We do this thing called a soul food diet, which isn't a diet at all. It's just processed fats and basically something that shouldn't be eaten at all. It has an effect on them. And the obesity and overweight, black women are very much overweight in this country. That's because of the diet and the demands of this lifestyle that they have, where they just become what you call couch potatoes. And we do a lot of watching TV. We watch television more than most races in America. A lot of watching television and sitting there eating and eating and eating. The primary thing that we have to focus on is the emotional connection with food. Well, this is not going to be easy. It is not going to be easy now. Food is made to taste good with chemicals. We have been chemicalized. People walk around with deodorants on and colognes on that don't even resemble anything in nature. The smell of these things don't resemble anything in nature, but we find them pleasing. So what the people's taste buds are and what an actual taste bud is two different things. Two different things. This whole thing is a matter of social engineering. We have been trained that these things taste good. They do not taste good. They have an off flavor in them. The way to get around that off flavor is to not use this parotid gland. It's the gland that swells up when people have the mumps. If you chew your food thoroughly and it's been grown on synthetic fertilizers, you will taste the off flavor of the food. So the industry wants you to take a couple bites and then swallow down with a Coca-Cola or something. But if you really enjoy the food, the longer you keep it in the mouth, the longer you get that enjoyment. So you get more for your money if you just chew the food, but we don't chew the food. We just take a couple bites and swallow it. They don't want you to chew it because you will taste the chemical taste, the off flavors as we call it. So all of that's part of the whole thing here, that's wrapped into this, how we've been trained to approach food, how we have this emotional connection to food. All the animals eat food, fish, ducks. They don't sit around just, why do we do this? Why are we the ones overweight? Animals in their natural environment are not overweight and they do not die from disease. We're accepting disease as normal. Disease is not normal. We have been trained to think disease is normal. But animals in their natural habitat, eating what they're supposed to eat, do not die from disease. They may die from somebody shooting them or a predator, but they're not going to die from disease. And they're not going to overeat. They're not going to be overweight. Despite how big you think an elephant is, an elephant does not overeat. You eat when you feel full, stop. Don't wait till you feel your fullest. Just when you feel full, stop. But we just keep eating and eating and eating because we are eating for emotional reasons. Salt is associated with anger and frustration. Black people eat more salted potato chips than any group in this country. So we're angry and we're frustrated. Then we love ourselves and don't love ourselves. Then we want to have a family that's all together and we're around all these dysfunctional brothers and sisters and relatives, mother and father. We're in a dysfunctional zoo. So we're eating food to compensate for this dysfunctional family. It's still emotionally centered.